Hi, we are going to do a small series of clips on the most common abnormalities or most common findings that we come across in fetal scan reports. So today's topic is going to be single umbilical artery. So normally the umbilical cord of the fetus has 3 blood vessels. There are 2 arteries and 1 vein. In some cases, there is 1 artery and 1 vein in the umbilical cord of the baby. So as we know, the umbilical cord is the structure which carries the blood from the placenta of the mother to the baby. So when we see a single umbilical cord, the first thing that we check for is the rest of the anatomy, the structures of the baby. Because the single umbilical artery can sometimes be associated with structural defects in the baby, like abnormalities in the spine or the kidney or the heart. So a detailed examination of the baby is done and to identify if there is any structural defect. In majority of the cases, there is no structural defect. Next consideration is there any markers or risk factors for chromosomal problems? That is evaluated. If the baby is structurally normal, growing well, and the single umbilical artery is an isolated finding, then we inform the parents that we need to follow up for the growth of the baby, because single umbilical artery can sometimes be associated with evolving fetal growth restriction, which will be seen in the later stages of pregnancy. So serial growth scans will be required to monitor the growth. And we also need to do a detailed postnatal, that is after the delivery of the baby. The baby needs to be examined in detail by the pediatrician, giving importance to checking the patency of the trachea, that is the windpipe, the swallowing passage, the esophagus, and to see if the baby is passing motion, to ensure if the anus and the lower part of the gastrointestinal tract is patent. Because these are things that we might not be able to see on the ultrasound, but this needs to be checked for because of the association between single umbilical artery and some of these abnormalities. If all of these are done after the birth of the baby, the umbilical cord is removed, and most babies, I should say more than 95 or 97% of these babies who have an isolated single umbilical artery have a normal outcome. So it is not a major abnormality. It is something that can be taken care of. Thank you.